No? You can't hear me? I'm Mike Pfeffer. I'm the Chief Executive Officer of the Kodiak Area Native Association, and with the blessing of the KANA board and board chair, Ms. Loretta Nelson, I'll call the meeting to order. I'm Mike Pfeffer. I'm the Chief Executive Officer of the Kodiak Area Native Association, and with the blessing of the KANA board and board chair, Ms. Loretta Nelson, I'll call the meeting to order. Chief Executive Officer of the Kodiak Area Native Association, and with the thanks for coming, everyone. Thank you. That's a pretty aggressive flame there. We'll keep an eye on it. Wick back. Thank you. That's a pretty aggressive flame there. We'll keep an eye on it. Wick back. There we go. Thanks. Thank you. That's a pretty aggressive. And for the invocation, Miss Mary Fern.
You can stand if you like, and you don't have to if you don't want to.
Thank you. And for the invocation, Miss Mary Fern.
Is this going to go on throughout the whole? You can stand if you like, and you don't have to if you don't want to.
Thank you. And for the invocation, Miss Mary Fern.
Is this going to go on throughout the whole? You can stand if you like, and you don't have to if you don't want to.
Thank you. And for the invocation, Miss Mary Fern.
Shall I start? Our Heavenly Father, we as members of the Kodiak, the KANA membership, are grateful to come and see this lovely building that we have in our presence. We're grateful for those that came up with the plan and the building, and we're grateful for the construction workers that build it. At this time, Heavenly Father, we ask for thy blessings to be upon us as we are at this membership meeting to elect new directors to the board. And we pray for them, those that from the different villages that work in our behalf to make us a successful membership under the KANA umbrella. We're grateful for the many hands that have put together this meeting for us. May they be blessed also. And we ask for blessings to be upon those that also are the leaders, the CEOs, and all those that make KANA run smoothly. We're grateful to get a sneak peek at this building. And we as membership have the right to be very proud of it. And we hope that we can maintain its beauty. And we ask thee to be with us throughout this meeting, that we can conduct it in a very righteous manner. We say these things in the name of thy Son, Jesus Christ. Amen.
Thank you, Mary. I'd like to thank the catering. Breakfast was provided by Java Flats, and lunch will be provided by Barefoot Bakery. So I just wanted to recognize those folks for all of the work that they've put into providing catering for today's meeting. I'd like to entertain a motion to approve the agenda of the 2023 annual meeting. It's been moved and seconded. Is there any objection? We would have a brief moment to have that discussion after the presentation of the board nominations and candidate comments. Any other opposition to approving the agenda? Hearing none, the agenda is approved. Is there a motion to approve the minutes of the 2022 annual meeting? It's been made and seconded. Is there any objection to approving the minutes? Hearing none, the minutes are approved. I'd like to introduce the KANA Board of Directors. Ms. Loretta Nelson, Chair, representing the native village of Afognak. Ms. Phyllis Emoto, Kodiak Village, Vice Chair. Ms. Cheryl Christofferson, At-Large Secretary. Janine Marsh, Shunak Tribe of Kodiak, Treasurer. Mr. Larry Chichinoff, Native Village of Yuzinki. Ms. Desiree Aluska, Native Village of Akiak. Ms. Chrislyn Hohen, Tinignac Native Village. Ms. Stella Crummery, Alutiiq Tribe of Old Harbor. Nancy Nelson, Native Village of Port Lions. Mr. Alexander Panamaroff Jr., Native Village of Larson Bay. Thank you all. And we will have special guests, Ms. Valerie Davidson with ANTHC, Mr. Alan Veerling, the ANMC Administrator, and Ms. Joy Mariner with BDO KANA's Audit Partner. I'd like to present the 2023 board nominations and candidate comments. We have Ms. Loretta Nelson from the Native Village of Afognak.
Good morning, and I just want to say thank you all for being here, and thank you for allowing me to represent you on the KANA board. For those of you who don't know me, I'm the daughter of Willis and Martha Nelson of Port Lions and Afognak. Serving on the KANA board has been both rewarding and challenging. It is also a privilege to work with such a great team. Your, your KANA board and staff work together as a team to bring the best health services possible. The KANA board is made up of members who serve for their village chapters. But as a board, we all come together and represent the island as a whole. KANA also works to collaborate with our tribes, village corporations, regional corporation, Kodiak Island Housing Authority, and other local entities to meet other needs of our communities. An organization is only as good as those who work for it. I want to express my sincere appreciation and thanks to our executive team and all of our employees. Thank you for your continued hard work for the people of our island. And I also would like to thank those of you who have supported me. Kuyana.
Thank you, Loretta. I'd also like to introduce Mr. Tikan Simeonov, native village of Kodiak.
Good morning. As you just heard, my name is Tikan Simeonov. I am the eldest son of Spiridon Mitch Simeonov, Senior. So I'm sure a lot of you know him, and my mom, Judy Simeonov. Just a little bit about myself. Several years ago, when I moved back to the village of Kodiak from Old Harbor, I got a job as in the post office in Kodiak, and for a long time I wanted to just be that. I'd be in the post office, be out of everybody's way. But very soon after I got the post office job, my uncle David Senior resigned from the city of Kodiak council, and unbeknownst to me, I was appointed his seat on the city council. And since then, I've been working with the city council, finding out what the village needs on the city council and what kind of jobs that needed to be filled. So I became a do-it-all. I work in the post office. I work as the generator power plant operator. I work as the alternate for airport maintenance, and I also do the annual sewer and water maintenance. So, and many other jobs that I have. I never really wanted to be a person of authority in the village. I was very happy to be just a worker. But things have come to light that I noticed in our villages. When the school in each and every village has a career day or a job training program, a lot of times the people that come into those villages to advocate for jobs here in Kodiak, outside of the state of Alaska. Hardly anybody advocates for the jobs needed to be filled in the village. So that is my wish, is to advocate for jobs that are in the villages, advocate for the KANA employees that are in the villages. make sure that they get the assistance they need and the help that they need. Like Akia currently has one health aide, and health aides have a really high burnout rate. So I want to make sure that our village gets more than one health aide and keeps them. And health aides are a high turnover position in our villages. So that's my hope, to be a part of this KANA board, is to advocate for the KANA employees in the villages and jobs that need to be filled there as well. Thank you.
Thank you, Tikan, and thank you for your willingness to serve on the City of Akiak Council, even though you didn't know you had signed up for it. As you know, we have elections for 2 chapters and then a proposed change to our Articles of Incorporation. That's the next item on the agenda. We have a brief moment for a comment or comments on that proposed amendment to the articles. Is there anybody who'd like to comment?
Because there are some changes in this that are detrimental to our individual tribal organizations. And I don't think that the people in each village realize that. We've never had an opportunity as an organization, even through KANA, to come together and go through this article of incorporation. Let me tell you a little bit about my background so that you know what I'm talking about. I started working with the state of Alaska in the court system in 1980. I've worked as an Indian child welfare worker. I've been trained in that field. I've worked for the state of Alaska as an OCS specialist. I've developed tribal code for tribal law. So when I read this, I understand exactly what's on here. What's being said verbally to each and every one of you tribal leaders is not what's written in this document. There are some changes that need to be made before we have a vote where we change the KANA Articles of Incorporation. And we need to be given that opportunity to speak on this and not just send it out in the mail and have people throw it in the garbage. It's just from KANA. That's not going to work. There are recognizing KANA as a tribe is not good for the tribes of Kodiak. KANA is a nonprofit business that is under the umbrella and protection of each and every one of the tribes on the island. But KANA is not a tribe. In this document, KANA becomes a tribe. That's not the way that I, as a person growing up here, who's lived most of my life here, understands how KANA works. KANA is not a tribe. KANA should never be a tribe. KANA should have sovereignty, protection, but KANA should never have sovereignty. Sovereignty is saved for tribal councils, not businesses that are owned by the tribal councils. There is a lot to be said here, and the people don't know about it. And the way you're going about, I just found out that we're voting on this today out there, and we've never had an opportunity to talk about all these things. I just wanted to express how, when you have words that can change in documents like this, the previous president, along with the some of the KANA board members that are here now, changed one word in the article of incorporation. And by changing and taking out that one word, they were able to kick out one of our villages from this KANA organization. And I think that's wrong. And I think that KANA should reinstate their membership because they are the people of this island. And I don't know how many people know that. That Carlick membership was totally taken away from them by one word, changed in the article of incorporation. Another thing on this document is they are recommending that you take out the words "of the same." People don't understand. When you take out those words, it reads, "The article of incorporation may be amended at any regular meeting of the members of the corporation or at any special meeting of the same," which means the special meeting has to be called of the membership, which is all of us and all the tribes. By taking out that word, "called for the purpose by a vote of 2/3 of the members present," that means that the articles of incorporation from here on out can be changed solely by the KANA board members, and that is wrong. They should be changed by us, the membership. Another part that I see is there is contradictory to what you write and what you say. But I have it written down here somewhere. But anyway, I just wanted to say that we need more time. The villages and the people need to know exactly what's in here. You have things that should not be in here. And one of them is making KANA a tribe. KANA is not a tribe, never will be. And I am in total opposition, and I hope until all of you learn more about this one particular document, that you do not vote for this change. Thank you.
Thank you, Sandra. I want to also announce or mention our election committee. I didn't read their names earlier. We have Miss Marianne Miles, Miss Patricia Kozak, Miss Margie Nelson, and Mr. Greg Zaginaw. I have a little bit of time to provide an update. We have, I understand, our auditor available at what time? 11:15? Yeah. Okay, and we have ANTHC, they're available now? Is that right? Yeah. Okay. While the ANTHC folks get queued up, I'll go ahead and just give a few updates organizationally on KANA and what we've been doing for the last year. One, I wanted to mention this building that you're all getting the chance to see today. It's something that has been a work in progress, a long time coming, something that I'm really proud of. I think it sets a really good example for the whole Kodiak community on what can happen if you put your mind to it. We have a space here that I hope you're all proud of. And I think that the services that we're going to be providing here, the opportunity to have a space downstairs where businesses will be bringing people together is really great for the community. I had the chance a couple of high school kids popped in yesterday. They walked by and saw the door open and asked if they could see what the building looked like. And I said, sure. And one of them said, this is great because right now I have to go to Walmart to hang out. And I thought, wow, if you're going out to Walmart to spend some time walking around with your friends, this hopefully will be a much better place for you to come and sit down and really turn this into a community space. And that is the intention also, is people can come in here and sit down and talk and enjoy yourselves and feel good about who we are and what we've done and what KANA is and what we want the community to be. Yes?
Proposal?
Sure. Would you like a
Yeah, there were a
comment, Sue?
couple of us with our hands up.
Sure. Sorry, I didn't see it.
That's
Yeah.
okay. So, speaking to, what Miss Sandra, okay, Sandra, thanks, Sandra. I do appreciate you bringing attention to the details of the proposal. I wondered also and thought real carefully about the terms. I do think that we have to keep in mind tribes are defined by the federal government, federally recognized tribes. KANA is not a federally recognized tribe. And these I don't think these change that. It's a corporation, as it says, all throughout the document. So just because an organization says that they're an intertribal consortium does not give them tribal recognition as within the system. So intertribal consortium, I'd like a little bit more information on what that is. But your comments about Article 11 are a little bit concerning to me, because it does remove the members being a part of changes in the amendments or in the articles of incorporation. So that's a little bit concerning, other than the fact that we vote in people who represent us in the corporation. So I don't know if that gives any more clarity to folks, but Article 11 is a little bit concerning with that. But again, just because they're saying intertribal consortium doesn't make them a tribe and should never take away tribal authority. So, but I would like to understand a little bit more how the role of KANA will change as an intertribal consortium.
Sure, thank you for the comments. And to address Amendment 11, Sandra, we'll get you a microphone.
Here's a concern of mine. If you read on this proposed change that they have right here, in Article 6, it says the corporation is a tribal organization and an Indian tribe within the meaning of the federal statutes. Well, if we agree to this, our consensus here agrees to what they're putting in front of you, that we, the people of this island, recognize this organization as a tribe. And the federal government is going to go according to whatever the tribes want. So KANA's going to, if you approve this the way it is, KANA's going to become a tribe. And once they do from the villages, then they will go after tribal recognition. It's just all in the writing. You have to know what you're doing, people.
To the Article 11 question, the change in that is removing 3 words of the same. That doesn't change how articles would be changed moving forward. It describes the membership or the members.
Present when you decide to do it will be the board of directors, if it's not a special meeting of the same, which is regular meeting of membership of the corporation. Taking out those words changes the whole context of the paragraph, and it discounts all the members and puts everything that can happen in this organization solely in the hands of the board of directors, and I'm not for that. It's the membership who shall change the articles of incorporation.
Thank you.
I doubt I need a microphone, but I'm wondering why when you contact or reach out to board members, they don't get back to you. That's wrong. I've reached out on multiple levels. I've asked the secretary upstairs, how to contact it, and it's an I don't know. So I've looked it up, had to try and contact a few of you via Messenger to call me. Thanks for the return calls, because I've had questions for a while. And if that's how you're running the board without listening to the people, then maybe it's time for you to step down, because we do deserve to be heard. When we don't know who to talk to at KANA, because we're gonna get no answers. Thank you, board members, for not getting back to me, but I think other people have that same problem.
I want to take a few moments to acknowledge the folks who, as I was speaking earlier about putting this building together and preparing for the meeting, I wanted to thank the people who put in a great deal of effort over the last several months to make sure that the building came together, the last several weeks, to get this space ready for you, and then today, working on the ground and fixing our IT issues so rapidly, making sure that, that everything is running as best we can hope for on our first day. I want to acknowledge KANA's administrative support staff, our Chamai home visitors. We had folks from across the organization pitch in and help out. And at first I was reluctant to name departments or even teams, because I was afraid that I would forget somebody or some group of folks. So I just should probably first say thanks to all of KANA staff who have really jumped in and helped out selflessly to try to make this meeting as good as we can make it for you today. Our Chamai home visitors, our communications team, our facilities staff, our human resources team, information technology. Thanks again. The echo at the beginning was a fun start to the day, and you fixed it up so rapidly. I appreciate that. It's a lot of work, and I understand, and it's pretty stressful for you, but thank you. Our insurance and billing staff jumped in to help out, and our workforce development team did too. So thanks to all of those specific departments, and thanks to all of the individuals at KANA who are here today or who helped to bring you all together for this meeting. I wanted to thank, oh yeah, sorry. Thank you. I wanted to thank Hannah Scholl and Chris Luckenbach. They generously allowed us to feature their art and photography, contributing to the annual meeting's publication and design. So you'll notice around here and in the materials that you have present, I'm really proud of the work that our communications team has done over the last year to improve the quality of our communications and hopefully the frequency of communications, so that we're as transparent as we can be with the services that we offer and the activities that go on behind the scenes to support you as our beneficiaries. Our website is a big change over the last year. If you've had the chance to check out our website, that was a real big improvement. I want to thank, again, I don't want to mention any specific communications folks because I'd probably forget somebody, but they've worked really hard, and I wanted to specifically mention that team. I do have the opportunity to announce a few of the businesses that will be downstairs. We have been allowing the businesses to announce themselves, but we didn't want to open the door too soon for them. But we do have the Alutiiq Museum, who will be occupying space downstairs. The museum will be closed for the next couple of years for renovations, and so they will have their gift shop and a small gallery downstairs so that they'll still continue to have a presence in the community while the doors to the main museum are closed. Barefoot Bakery will have a space downstairs. They've already started moving in kitchen equipment, so that'll be really exciting. The smell of cinnamon buns in the morning walking in here will be nice. I don't know if Chad is here. He might be baking right now. I think Chad's responsible for lunch, so he's probably in the kitchen with his Kiss the Chef apron on. But he's really been working hard to make sure that the services and the bakery that they've been offering over the last 10 years and from a much smaller venue will be available to the community. We have Grand Slam Toys and Books, the Islander Bookshop, and Hannah Scholl, Kodiak Crystals and Art by Hannah Scholl, the United States Postal Service. We have a restaurant that hasn't yet provided the name that they'll be using, and we also have a small grocery store that will be moving in downstairs. All but one of those spaces are filled, so it's really exciting, and that we think that that other space will be filled pretty quickly. Wanted to mention one particular thing that happened over the last year, because this was a special project of Miss Margaret Roberts, a longtime community leader, KANA board member, and served in many capacities across the island. She worked long and hard to rename the armory, and that happened this past July. Memorializing the Kodiak Readiness Center, renaming it for Daniel Lee Harmon, a young Alutiiq soldier who died in Vietnam while valiantly saving the lives of his fellow soldiers. I sat in many meetings with Margaret over the years where she advocated fiercely for that to happen. And seeing it happen this past year really made me proud and made me appreciate all of the efforts that Ms. Roberts and many other people did to make that happen. This past year, KANA opened space in Anchorage. We have an Anchorage office where patient advocates who support folks at ANMC are located. The other opportunity that allowed us with the pandemic and having many remote workers, we recognized that we could have people supporting KANA that didn't necessarily need to be in Kodiak. And it's with a workforce shortage that we're experiencing, having the ability to recruit talent that may be in Anchorage and unable to relocate full-time to Kodiak has provided a great benefit to us. So we have in Anchorage, I believe we're up to 6 staff who are in that Anchorage office. 3 are working to support our patient population at ANMC, and then we've got 1 in our finance department and 2 on our grants team who are working in Anchorage. So it's been a great opportunity for us to tap into a human resource pool that was previously perhaps unavailable. Thank you. I think is ANTHC, they're on now, is that correct? Okay. I'm going to go ahead and hand it over to Val Davidson.
Good morning. Can everyone hear me? Okay, great. I was looking for the nod from Mike. So Guyana. Please excuse my voice today. I unfortunately I came down with the flu this week, so I'm just gonna power through. I apologize for the sound of my voice. So really quickly, huinga nukakalugo, mislamakananslu, yupiugo, mamtakaitlakamiu, anaka, guyilakamiuk, ataka, gasauk, Port Orchard, Washington, nakamiuk. Huinga, kekwa naugwa, Slinkeraugwa, Hideaugwa, Jalnach Higginsaugwa. Hi, my Yupik names are Nuchagalak and Amishamakanan, and my English name is Valerie Davidson. And I was born and raised in Bethel and also Upriver and Antioch. I was also adopted by the Jackson family about 20 years ago, maybe almost 30 years ago by now, in Cake, and they're both Tlingit and Haida. And I was given the Haida name Jalnach Higgins, which I'm told means noisy lady, but I don't think I'm actually that loud. I think it's just because I have a really good, authentic Native woman's laugh. So I have the honor of serving as president and CEO of the Alaska Native Tribal Health Consortium. And I started my tribal health career at the Yukon Kuskokwim Health Corporation in 1999. And I can't believe I've worked in tribal health for this long. And I know that I work in Anchorage during the winter, and I spend about 6 weeks working from Bethel in the summer. And like all of you, being in my home community, being able to work there, and making sure that my children understand who we really are as people, not just what we do for jobs, is a really, really important thing to me and my family. I want to extend Guyana to Chair Loretta Nelson and the KANA board and CEO Mike Pfeffer and the KANA staff for the opportunity to participate in your annual meeting. And especially for virtually this weekend, we're actually preparing for ANTHC board and committee meetings next week. And so appreciate allowing me to participate virtually along with Alan Vierling, our ANMC administrator. I want to acknowledge your chair, Loretta Nelson, who serves as director of the ANTHC board, and also Margie Nelson, who serves as alternate director. I want to first thank you to the KANA board and staff for allowing me to participate in your May board meeting in person. And I appreciated the frank and candid conversation about improvements that we need to make, especially with regard to patient travel. And those conversations were really, really helpful. That kind of direct, frank feedback is really, really important as we improve our services. And I also especially want to thank the board for the really warm welcome that you showed to my daughter, Kylie. And as we left the island, she was already asking when we're coming back. And she's actually interested in a health career. She has been planning when she's done to go work at YKHC in Bethel, but I don't know, our visit to Kodiak, I think KANA really gave YKHC a run for their money. So we'll see what she decides. Alan Vierling, as I mentioned earlier, the ANMC hospital administrator, is joining me today and will provide some specific ANMC information. But just to launch into it really quickly, ANTHC, as you all know, is in a pretty significant transformative phase of our organization. We know that based upon our assessments that we made over the last couple of years, we need to make improvements in patient care, quality of all of our services, not just at ANMC, improvement in our financials, and also improvement in employee engagement. And we also recognize that any one of those is really challenging, but doing them in all four at the same time is really, really difficult. But that's okay. We come from good, stubborn stock, and we're just going to lean in to be able to get that work done. And this, of course, comes at a time, and Mike mentioned this earlier, really the healthcare industry nationally is facing some challenges due to some pretty critical staffing shortages everywhere. We're all competing for the same staff. There are increased costs of doing business, And hospitals around the country are really seeing operating losses and declining reimbursement rates, not only in Alaska, but really in places that are really high, considered the best hospitals in the country, like Mayo Clinic, Providence, the Cleveland Clinic, and many others. And fortunately, many Alaska tribal health organizations are boosted financially by rural reimbursement rates, joint venture packages, which is wonderful, and absolutely take advantage of every one of those opportunities. KANA has done a really good job pursuing those opportunities. Unfortunately, NTHC really doesn't benefit from those opportunities. We currently don't qualify for the joint venture package, which pays for staffing. So one of the things that I so appreciate about the ANTHC board is that they are making really, really difficult but bold decisions that will really change the trajectory of our organization. And for the first time, the ANTHC board last year approved a 3-year strategic financial plan for 23, 24, and 25 to ensure that our financial investments as an organization really align with our goals for improvement. And so in 23, the board recognized that we had not made critical investments in IT equipment, in facilities, in medical equipment, and in clinical areas in about 10 years. And so really made the decision that over a 3-year period would make catch-up investments to be able to get us caught up. And those investments are really necessary for us to be able to break even and turn the corner in FY25. So in FY23, the board approved a budget of a negative 2.6 margin to be able to address those catch-up investments. And we recognize that we never want the urgency of catching up with those investments to really compromise our long-term health as an organization or sustainability of ANTHC, because we recognize the critical role that we play for all of our patients as a statewide organization. The good news is we're turning things around. It's not happening as quickly, I think, as we like. While I come from good stubborn stock, I also come from really impatient stock, which sometimes is a good thing, but sometimes can be really challenging. So we know that the ANMC hospital today does not meet our current needs. And a lot of folks don't know that when the old ANS hospital on 3rd Avenue was built in the 50s, it had 400 beds. And the new ANMC, that was built in the late 90s, has less than half that number. Currently, we're accredited at 182 beds. And so it's just incomprehensible to me today that any of us would accept a facility that is half the size of what it currently is. And so we're not surprised, nor should we be surprised, that we're facing capacity issues. So while we have challenges, we're not on the IHS replacement list because that list has been grandfathered until existing other hospital needs are met across the country. And right now we're not eligible for the joint venture program. We really have to address that capacity issue on 2 fronts. One, really making our programs in our current space more efficient. And Alan will speak to this in a moment about how we've improved things like efficiencies in our operating rooms. We also have to, that also means, because we're not on the IHS facility list, we have to expand the hospital with our own financing. And we're refining those expansion plans. They've changed a couple of times over the last couple of years because what we've learned from the pandemic has really changed how we deliver healthcare. And we're also concurrently undertaking a campus master facility plan, which we haven't done in some time. So I talked last year about how the board approved a 3-year strategic plan. And it also, while it's easy to talk about what those things are, it's really, really hard to do it. And Also, though, we have to remember that we have to celebrate those accomplishments when they happen. Otherwise, when we're in health, it's tough right now in healthcare. It is really, really hard, especially for people who are already just exhausted from dealing with the pandemic. But we are making some progress. And I want to thank tribal leaders for your advocacy, which resulted in the bipartisan infrastructure bill, which included $2.2 billion, billion with a B, for sanitation facilities funding for Alaska. And this year, Alaska received over $440 million to support 42 water and sewer projects. And that includes $9 million in funding for sewer system upgrades in Old Harbor. And I know it's been a long time coming, and I want to thank you for your advocacy for making that happen. You know, one of the ways that we measure also our progress is really with national benchmarking. And CMS, or the Centers for Medicare and Medicaid Services, rates hospitals on a 5-star Medicare rating system. And ANMC has been a CMS Medicare star-rated hospital of two out of 5 since 2016. And we said, well, that's not acceptable to my children, to the future tribal leader that I just saw walking in front of the camera there. That's not acceptable to those children, to our future leaders. It should not be acceptable to us today. And as we were striving to improve from a 2-star rating, some folks in the organization said, that's not going to happen until we expand the hospital. And we said, we at least have to try. We have to make those improvements. And thankfully, Alan Vierling, who you'll meet here in a moment, did not share that view and undertook a significant improvement effort. And ANMC recently improved to a 3-star rating after being a 2-star rated hospital for many years. And while we recognize that's not where we want to be a 4-star, we want to be a 5-star hospital, we want to be the best. We also recognize that an improvement in our star rating is an indication of the progress that we're making. And I want to congratulate and thank Alan and the ANMC team for making those necessary improvements. I want to thank KANA staff and leadership who participated in the travel summit that we held with the Alaska Native Health Board at the end of August, because we know we have long-standing challenges that our patients face when you travel to Anchorage for care at ANMC. And we've heard and we share the frustration that the process is really confusing. It can be really complicated. We have communication challenges are faced at almost every step. We have regulatory processes like Medicaid pre-approval, what housing is covered or isn't covered under Medicaid. And that just makes it really challenging for people who have to travel. And when you add somebody who's not feeling well, that just makes it even more heartbreaking. And so while our continuum of care that the Alaska Tribal Health System enjoys has really been a really good comprehensive system, our model that brings care as close to home as possible, while also ensuring that we can travel our patients when they need more acute care or managing complex chronic conditions. But it's also really challenging as we work together for travel. And so we recognize that, really ANTHC or ANMC really could make some changes to travel by itself, but that would be exactly the wrong thing to do, because any change that we make to travel impacts everybody else. And likewise for other tribal organizations, if a change is made to your travel program, it also impacts everybody else. Because really, we know that travel is the one area that with increases in funding from Congress, we have really had no meaningful increases in travel funding, nor have we had meaningful increases in purchase and referred care. And so it hasn't even kept pace with medical inflation, not much less regular inflation. And so that's a challenge for us. So we're working collectively on an advocacy effort to try and get more of those travel dollars to Alaska to help us with this issue. Because for a patient in the lower 48, when they have a medical emergency, they call 911. And for one, it works. 911 often doesn't work in our home communities, at least it doesn't in the villages that I'm from. And typically that means an ambulance ride, which is like a $300 to $500 ambulance ride. For us, it's a medevac. And if you're lucky, a cheap medevac is $25,000. If you're not so lucky, that medevac can be $250,000 or more. And that means those dollars really don't go very far. And so after that travel summit, and again, we appreciate the KANA staff and leadership who were able to participate, because what we asked for is people who one can make a decision on behalf of an organization, people who understand the financial challenges, but also the travel staff who really do the work to make all of that magic happen. And so there are 3 subcommittees that were formed. Purchase and referred care is one, patient lodging or patient housing is another, and patient travel. And those subcommittees are meeting to discuss the priorities and report back to a follow-up meeting we're having on December 14th. And again, we're just trying to make sure that we're making the right improvements so that we don't accidentally cause a problem for someone as we're doing that. We're also really committed to transparency. And, we have a perception right now, unfortunately, that limited travel resources are dependent upon relationships or informal exceptions. And I knew that when I had people say to me, wow, it's really great that you're there. The Yupiks are going to get a much better deal now, right? People from the Bethel area are going to get a much better deal. And it was like, what are you talking about? No, we want a fair process for everyone. And, my family, when they call me, I help them like I would any other patient, but I also tell them that they need to follow the process. And we help them through that process because we want a fair process to everyone. And so any changes that are made to statewide travel policies really need to be changed collaboratively. We need to document those in writing to ensure that everyone gets applied the same rules. And we understand sometimes there's a medical exception, there's an urgent medical exception that needs to be made, and we certainly will allow for that. But again, the process needs to be fair for everyone. I also wanted to let you know that as we've transformed our organization, we've also made some leadership changes, and that's a natural part of transformation that happens. We really work hard to retain employees that are committed to doing this work. But we also know that we are sometimes competing for the same employees. And so we know that one of our employees is soon going to be working at KANA, and want to congratulate you on that hire. And we think that person, I won't name that person in case it isn't public, but that's what happens in tribal health. We learn from each other, and we benefit each other when our staff moves on. One change we made is that Natasha Singh, many of you may know her as she has worked in tribal health, is from family from Stevens Village, has been the co-lead negotiator of the Alaska Tribal Health Compact. Since I stepped down as co-lead negotiator, I was co-lead negotiator of the compact for 11 years. Natasha has been co-lead negotiator of the compact since, I think, 2012 or 2013. It might have been 2013. Natasha came to us from Tanana Chiefs Conference, where she started her health career, and she has been promoted to executive vice president and also vice president of legal affairs. And I also wanted to introduce, and he will be speaking here shortly after I introduce him. After we had a vacancy in ANMC hospital administrator, we did a nationwide search for hospital administrator. And we received over 220 applications, and over 27 finalists received a first round of interviews. And ultimately, the Joint Operating Board, ANMC Joint Operating Board, endorsed the hiring of Alan Vierling he was also endorsed by the ANTHC board. He was hired as the ANMC administrator based upon his over 40-year proven track record of hospital turnarounds in the country, including in the emergency department, the busiest emergency department in the country during COVID. And he has been in his role since the end of March, after serving as interim since October of last year. And we're already seeing results. He's certainly ruffling feathers because the direction that he has from me, which is also the direction from our board, is we want to see improvement at ANMC. Our patients deserve the best. That's not what they're getting, and we want to see that improvement. And we've had some pushback from some staff. And of course we would expect that when we know where we want to be is here, and everybody believes that we are here, but doing our own assessment of where we are as an organization indicates that we're actually here. That's going to be difficult. Those are some difficult conversations. Right-setting expectation of performance and right-setting expectation of improvement. And so I have supported Alan every step of the way, and really we're seeing those results already, and including, as I mentioned before, an improved Medicare star rating of 3 after being a 2-star facility since 2016. He's done what no other administrator before him has been able to do. And so with that, I will turn it over to Alan Vierling, ANMC administrator, to provide an update about the Alaska Native Medical Center, if that's okay.
All right, thanks, Val, and thank you, Director Nelson and Mike, for all of your help. And the Travel Summit was incredibly important. I want to start off with a couple of changes. When we took the opportunity to lead here at ANMC, access to care was one of our primary issues. And so we looked at 2 areas in particular. One, we looked at the clinics, and we looked at the way the clinic functions. And we looked at the referrals that we get. We get from around the state of Alaska about 57,000 referrals into our specialist every year. That's a very large number. And so we have had quite a backlog, and we have some opportunities. We made a number of changes. Dr. Cliff Schneider, Cheryl Leonard, a number of other people, Vivian Echevarria, who's been with ANMC for a long time, really have done a great job putting in some new processes. This year, we will see just over 10,000 more patients in our ambulatory environment than we saw in the prior fiscal year. 10,000 more Alaska Natives that we were able to care for than we did the year prior. So that's a rather phenomenal number. We think that number, quite frankly, should be much higher. We believe we can do quite a bit better. There are opportunities that we have that we are putting in place now to improve and enhance our services. We've done a really, I think, a good job of hiring providers for the first time in years. We are fully staffed with ear, nose, and throat providers, ENT docs, a critical need here in Alaska. It's a very important service for us. And for the first time, we're fully staffed there. And in fact, likely have the opportunity to hire 1 or 2 more than we would ordinarily have on our budget. So some things in the clinics are going very well. We have clear opportunities, but seeing 10,000 more patients in the past year than we have in years prior is really remarkable. We've done a very similar thing in the operating rooms. Whenever you see more patients in your clinics, you need more procedures, you need more GI scopes, you need more tonsillectomies, you need more total joints performed, hip surgery and knee surgery. And we've done a fairly successful job there. When we started back in October, we were getting about 1 patient in 10 into the operating room on time. Now we get about 9 out of 10 into the operating room on time. And so what that's meant for us is that this year, We were doing about 200 more surgical procedures every month than we have prior. And so if you look at the surgery volume that we are performing compared to years past, this is the busiest we've been in about 7 years. We are exceeding, I believe, anyone's expectations for the amount of surgical procedures that we're doing. And again, we appreciate and understand that we are not where we think we can be. We believe we've got opportunity. And so we're making some pretty significant changes going forward with surgical services, again, to really enhance access. Access has been our primary driver, and we're changing that. One of the unintended consequences of access does in fact impact on housing and travel. This year, we're going to do about 43,000 flights into Anchorage, 43,000 people that we will help get into Anchorage for care. That's a lot. And our travel office handles a bunch. We will put our patients and their escorts up in about 100,000 hotel rooms in the course of a year. So if you can imagine that in addition to running a really busy hospital, we also have an extraordinarily busy travel and housing operation that runs parallel. And as we get more busy in the hospital, then those numbers will increase, and that puts a strain on us. So we are doing things to make changes. As Val said, we know we have opportunity. Starting on November 1st, we will move our checkout time in the hotel and in patient housing to noon. So on November 1st, we're making that move. We recognize that that planes leave late. We've created some space in the lobby of the hotel and lobby of the housing, but our patients who come in need access to rooms. They are sick and they are tired and they've not been here to get care. And so we need to make that change, and we're going to make that change on November 1st. The other thing that people will see, we've rearranged the lobby in patient housing. We've restructured it to separate out the registration line from the information line. And so now we'll have 2 desks, and we'll also employ a system called NemoQ, which is what we use in our farm. And many people here are very familiar with NemoQ and the way it works. NemoQ will allow us to get patients registered. And if you are a confirmed patient, confirmation to housing, it allows us to go much faster and put some processes in place that work out really well in the patient's favor. So NemoQ is coming. That'll be on October 30th, noon on November 1st. We move to a noon checkout time. We are moving to a confirmation system that patients will get a text message just like they do for their appointments. We're going to put that in place for housing so that we know people are coming, and then we are changing our confirmation process and what that means. When you confirm, it should really speed up the process of getting your room. So there's a lot of work to be done. We are not satisfied with where we are. We recognize that there are frustrations. We recognize that there are challenges, and as Val mentioned, there are communication struggles. When you're this busy and you've grown faster than your technology can keep up, that's what happens. And so we are making significant changes, but all in all, I think we're headed in the right direction. Understanding that we've got a long way to go, we're delighted in the progress we've made in the last 12 months. Thank you.
If I may add one more thing, Alan. Alan, can you talk about how many calls the travel office gets a year?
Yes, ma'am. We get into our travel office. We receive 500,000 calls a year. That's 1 call every 1.2 minutes. And we make 300,000 calls. So in a travel office, it's staffed around the clock. We do 800,000 calls, which is a call about every 40 seconds. And if you can imagine your phone ringing every 40 seconds, it is a phenomenal thing. And we actually, out of 800,000 phone calls, we only drop about 24,000. So it's a very small percentage of patients that we don't get to. They call back typically, but it's about 1 call incoming or outgoing about every 40 seconds.
Uyana. Doi, that's it. I'm sorry, we can't hear you. Hoyana.
We have KANA Corporate Counsel, Mr. Richard Monkman online. I appreciate all the questions and want to offer the chance for Mr. Monkman, who drafted the proposed amendment and restatement of the articles. He heard the questions online earlier, so I wanted him to have the chance to respond to that. Mr. Monkman, can you hear?
Yes, I can. Here I am.
Thanks.
Okay, sure. Let's see, I first, I'm honored to be here at the annual meeting and want to say hello to all the KANA members present. The questions I heard were two questions. One is on the amendment to Article 6 relating to sovereign immunity. The other is the question on Article 11 relating to amendments. So with Chair's permission, I'll take the question of sovereign immunity first. KANA is not a federally recognized tribe and is not eligible to become a federally recognized tribe. But federal law has many different provisions which apply to tribes and also which apply to tribal organizations like KANA. All of the regional health organizations in Alaska are considered tribal organizations under the Indian Self-Determination and Education Act and the Indian Healthcare Improvement Act. And for purposes of those statutes, and just for purposes of those statutes, the regional health organizations are considered by federal law to be tribes. It doesn't mean they're federally recognized tribes. It means that KANA is entitled to use the programs, get the benefits, and expand services to its members as an individual tribe would be able to if it was operating programs under these two statutes. So where the first phrase says the corporation is a tribal organization and an Indian tribe within the meaning of 25 United States Code 5381B and 25 USC 1603, that's simply reciting the federal law. For the purposes of 5381, which is the Indian Self-Determination and Education Assistance Act, and for 25 United States Code 1603, KANA is considered a tribe. I mean, this is basically reciting exactly what it says in statute. That simply means that KANA can operate programs under the Self-Determination Act, under the Indian Healthcare Improvement Act, as it has done now, quite successfully, done very well, for many, many years. So what this amendment does is emphasize something which the federal courts have already held applies, but putting it in your articles so that it's clear and clean in case there are any attempts by third parties to assert otherwise. KANA is comprised of its member tribes. They're called constituent tribes under the law. And each of those tribes has sovereign immunity from lawsuits, in particular. Sovereign immunity is very important protection, which goes to tribes to prevent tribes from having their assets taken away through litigation, through foreclosures, through condemnation, that sort of thing. There's a legal scholar who has said that the history of Indian property in the United States is one of theft. There are many forces from the state, from private parties that look on Indian tribes and tribal assets essentially as easy targets. Sovereign immunity is an inherent right of the tribes, and it protects you from those kind of attacks, which can be serious, substantial, and expensive. Now, because KANA is comprised of its constituent tribes, KANA is like a bundle of sticks. It is made up of individual tribes that the law says that KANA is considered to be the arm of its tribes. That is, KANA's role is to, through the tribal representatives, through the members, to work for the tribes, to operate the tribes' programs, to use the tribes' funding appropriately and correctly. And as part of that, being made up of constituent tribes, along with that comes the umbrella of the tribe's sovereign immunity. That is, just like a tribe can't be sued without its consent, KANA has sovereign immunity from lawsuits. KANA essentially enjoys the protection of the tribes. It's not taking anything from the tribes by enjoying the tribe's sovereign immunity. The tribes are extending this protection to KANA. So the reason the article is put in here is because we have found that the courts will look to the corporate articles to see whether the tribes are extending their sovereign immunity to the organization. We represent regional health organizations all over the state, and this is a common question that comes up. By extending the sovereign immunity of the tribes to Canada, the tribes do not decrease their sovereign immunity. It's an expandable concept, if you will. The tribes are able to extend this protection to Canada because Canada is your arm. KANA is operating your programs. KANA is providing health services to your people. Through this amendment, it is confirming that the protection of the tribe that the tribes have as sovereign nations extends to KANA, which is operating for you, which is actually comprised of you. So again, I know it can be a little confusing, the nomenclature that federal law uses, but there really isn't a question about whether KANA is a federally recognized tribe or not. It isn't. This doesn't make it one, but it does protect KANA from the type of financial attacks which we unfortunately often see. So that's, I hope it's an explanation that people understand. It's important protection for KANA, and it's tied very closely to KANA's existence as the arm of the tribes, as the arm of the tribes of the Kodiak area. There was a question also on Article 11 about amendments. The use of the word corporation in the amendments is just simply stylistic. It actually doesn't change anything legally speaking in the article. I think the previous language was the articles of corporation may be amended at any regular meeting of the members of the same. It's a little confusing. The articles can only be amended by the members of KANA, and that's those of you who are here today and those who aren't able to attend. So the changing of the word corporation is simply stylistic. It's gone through just to clean up the articles of incorporation, which were drafted some time ago to make them consistent. But amendments can only be passed by this body, the membership of KANA, at either a regular or special meeting called to do so. So, Mr. Pfeffer, I hope that answers the questions. Is there anything else I can add?
Yeah, thank you, Mr. Monk. One quick question here.
Thank you. So in order to protect the tribes from, well, let me back up. Shouldn't the authorization for KANA to act on its behalf come from a compact made by each of the tribes? represented by KANA?
In fact, thank you for the question. In fact, it does. When a tribe assigns its programs under the Self-Determination Act or the Healthcare Improvement Act to KANA, federal law says that essentially that the tribe is also extending the protection of sovereign immunity to KANA to protect the tribe's interests in those programs.
So is that done annually by the tribe?
Not annually. I think it's, and Mike is probably better to speak to that. When the tribes join KANA and assign their healthcare and self-determination act programs to KANA, that's when it occurs.
So a tribe can revoke it if they wish?
There are some restrictions, but yes, a tribe can. Federal law has some, it's a process, but it can be done. We certainly, I would hope that tribes would think very hard before even considering that step, because it's joined together. You have so many more resources and so much more ability to provide services to your tribal members through KANA than each tribe does individually trying to operate the programs.
Okay, thank you.
If KANA did become a tribe, how would that affect like all these people end up being tribal members? And does that affect our home base where we're enrolled at to affect the fact of our funding, because we don't allow dual enrollment? Is this going to cause a conflict of dual enrollment with having you guys as a tribe?
KANA, yeah, thank you for the question. KANA cannot become a federally recognized tribe.
At all?
At all. No, what this phrase says, federal law, this is actually referring to federal law, which says for purposes of operating the programs, a intertribal consortium is a tribe. That's the way it's phrased. But that's only means you can operate these programs, which otherwise can only be operated by tribes. But KANA cannot become a federally recognized tribe. Membership in KANA should not affect tribal membership at all.
Thank you.
This is Catherine Von Scheele. So what I just heard is that you don't want to be, you're protecting yourself so you can't be sued. Is that like, because I had a family member want to sue you guys for sending my cousin home too soon, and she died within hours or days of being sent home too soon with a severe infection. I know that's other people who are dying. I don't know how many of you here refer to KANA as a Kill Another Native Association, but are you protecting yourselves so that we can't come and sue you due to poor quality of health care? Is that what I just heard? It's a question totally.
No, that's not the case whatsoever. A person who has a claim for medical malpractice or any other kind of claim against a tribal organization, not just KANA, but all the others, Arctic Slope, Southeast Alaska, South Central, has a right to file a claim under what's called the Federal Tort Claims Act. And the government will evaluate the claim, settle the claim, and take care of the claim otherwise. Essentially, it's sort of what we call the best insurance money can't buy, because you have the entire United States Treasury there and available to pay claims arising out of any kind of malpractice or professional liability of any of the tribal programs. So the tribal members are protected. The tribal members, the members of KANA, the people who receive services at KANA, have recourse if they feel that there's been malpractice, if they feel they've been injured. You have recourse, and it's essentially unlimited federal funds to pay claims that the government decides are justified. So it's a little different. The sovereign immunity protects against third-party claims. claims from, people who assert, there are any number of claims that people file lawsuits about, contracts, that sort of thing. But it protects KANA just as much as it protects the constituent tribes who make up KANA.
Thanks, Dick. Go ahead, Sandra.
In regards to sovereign immunity, hi, I'm Sandra Catollicoff-Lester. When you talk about the beneficiaries have the right to sue, what tribal court are you talking about? Because when you have sovereign immunity, the state and everybody else has to go either through your own tribal court or through the federal government. So what tribal court is KANA as a tribe going to use?
In terms of, Sandra, are you speaking of, say, if someone has a claim for
Like the
malpractice?
young lady just said, she has a member who had died, and in the thought process, there might be the idea that they want to sue KANA. Well, if they can't go through the state, what tribal court are they going to use to get some, to be made whole in
Well,
regards to the death of their family member due to possible negligence on the side of KANA?
thank you, Sandra, for the explanation. No, you don't go to tribal court if you have a claim against KANA. It just like going to a community health center, a claim goes to the federal government. Under any of those claims get made against the federal government. There's a form you fill out. The claim is looked at first by the Indian Health Service and then by the Department of Justice. And usually one or the other agencies will try to resolve the claim. If they can't, and the family or the individual patient still feels the settlement is not workable, you go to federal court. This is federal law. It says this is the exclusive way of resolving these claims against any tribal organization, any tribe that's operating its own Self-Determination Act programs, or against the federal government. So the route is first file a claim on a Form 95, and then
I'm going to disagree with you on that point of view. Sovereign immunity gives the tribes the right to be sovereign. And each tribe that is sovereign has the right to have tribal court. So when you have a sovereign tribe and you cannot sue them, the people have to have recourse. And a tribe has a tribal court. So KANA's not going to have a tribal court, where you're saying that the only recourse for this sovereign is to go through the federal government. Well, that's not sovereign.
it is federal law, though, and federal law controls in this instance. If a person wants to make a claim against any of the tribal organizations or tribes that came out of one of the healthcare programs that KANA operates or that the other organizations operate, it has to go through this federal process. That's the federal law is sort of supreme in the area, and that's the way Congress ruled. So any claims for malpractice, any other claims of professional liability, slip and fall in the parking lot, all of those go through this federal process. And it's a fairly effective way of solving claims. As I said, it's unlike an insurance policy in that it's unlimited resources if a claim is found to be justified.
I understand what you're talking about. I totally get what you're saying, but I don't believe that's necessarily true. I believe that the sovereign community of Larsen Bay has the right to have a developed tribal court. And if there is because KANA is under the umbrella of our sovereignty, because they are a business, nonprofit, run for the beneficiaries who are the owners. KANA doesn't own us. We own KANA. So that's the arm, that's the extension. So if our tribe has a tribal court and there's a problem at KANA, I do believe we have total right to sue KANA in our tribal court and not have to go through the federal government because we're a sovereign nation. We have our own laws and our own rights.
Okay, thank you.
Thank you, Sandra. Okay, I want to, we've got one question, but I want to also ensure that our auditor has a chance to present. She has a window from 11:30 until 12.
Excuse me, Mr. Pfeffer.
Yes.
I really respect you a lot. I commend the job that you're doing at KANA, but you need to have an opportunity for all of us to understand this document today.
Thank you.
Thank you. Just real quick, I wanted to thank, thanks for the opportunity to be able to speak again, but I think that this really emphasizes the need for each of us to really understand the structure within our Native organizations. The federal laws, Alaska Native Claims Settlement Act, tribal law, they're very unique, you know, in the United States. And in order for us to be able to work within those laws and our own tribal laws, we have to understand them. And that takes really important representation on all of these boards and councils. And so as an educator, as a teacher, I start with the kids I work with. Thank goodness I've got high school kids this year, really encouraging them to get involved and to know these laws and to pursue the kind of education that will allow them to grow and understand and fill these seats that are in the tribes and corporations. But until those kids get to those other spots, thank you, each one of you, for taking it on. And I hope that each one of you is also, each of the board members and council members are mentoring somebody else to move into those seats. Anyway, thank you very much.
Thank you.
Mr. Pfeffer, before you move on, I just have one thing I'd like to read here. As a KANA beneficiary of not a KANA tribe, but of the tribe of Larsen Bay, I make a motion to table this presented proposed amendment and reinstatement of the Articles of Incorporation of the Kodiak Area Native Association until the KANA beneficiaries, and not just the KANA board members, have an opportunity to discuss the changes in a work session in the future.
Thank you. Motion has been made and seconded. Is that motion properly put before the membership, Mr. Monkman?
I believe so. And a motion to table takes precedence. So
I'm not sure if we have a list of who's here. A show of hands? Would a show of hands be acceptable? Show of.
If we don't have a list, then I ask that we just move on with the business, take that vote up after the auditor for a roll call vote. And if I may actually make one statement, as I understood from the attorney just now, what this is doing is formalizing our current practices. That's what it's doing. That's what I understand it to be. I don't think it changes that. So that is my understanding, which is why I would vote against your tabling of this.
Thank you. If I may ask the discretion of the membership, if we have the vote after our auditor presents, please. Just, our auditor has a special event at noon today, and I want to ensure that she has the opportunity to present the information, and then if we could take this up after her presentation. Thank you. Okay. Mr. Monkman, could you, is Mr. Monkman on the line? Could you advise on the proper procedure to delay this until after Ms. Mariner's presentation?
I think that since Ms. Mariner's presentation doesn't involve any action at this stage, the chair can simply postpone the vote until after that.
Okay, we'll postpone the vote until after Ms. Mariner's presentation. Thank you. Joy, are you available?
I am. Can you hear me?
Yes, we can hear you.
Oh, great. Well, hi, everyone. I've been listening in on your meeting for a little while, and I just love the passion that you have for KANA and for making sure that your communities are served well. I just love listening to your annual meeting, and I apologize I can't be there in person today. My son decided he loves to run, and so he's competing today at the state cross country championships alongside a bunch of Kodiak kids as well. Last year, he competed and didn't finish very well. And so we, health-wise, he actually collapsed at the finish line. So I have a little mama anxiety about being away for his cross-country race this year. So I really appreciate your grace in allowing me to present remotely and to be with you. And I will have time for questions, Mike. So if there are any after I go through the presentation, just ask that you ask them, and I will stay as long as I can to answer those questions. So my name's Joy. I know I've met many of you there, and I'm happy to present the results of the 2022 audit with you. And I did fly to Kodiak and met with your board of directors to go through the audit results in more detail and discuss some of the exciting things that are going on with KANA and some of the kind of financial implications of the things that you're working through as an association to make sure that your communities are served well. A lot of big investments going on, a lot of discussion around those with the board. And we did have, at least I think it was over an hour together to go through the financial results in detail. But my goal is to just communicate to you the results at a high level of the audit and also some key financial items that would be helpful, hopefully, for you to know. So we're going to go through the audit results and the single audit results. The single audit is for your federal and state compliance with your grant awards that you receive from the federal and state government. We're also going to cover some financial highlights and then have time for questions. So in terms of audit results, I'd always like to just remind everyone of what my role is versus what your management team's role is. And you did experience some turnover in your management team during the course of the audit this year and in 2022. Mike and his team worked really hard to bring on consultants to fill those gaps and to get the books and records closed. But the financial statements are your team's financial statements. We come in after they're completed and verify the books and records, test transactions, do various procedures so that we can form an opinion on the financial statements. Do we believe these financial statements are fairly presented? And the goal here is that, fairly presented means that somebody who uses the financial statements, whether it be you as a member of KANA or a banking or financial institution or a granting agency, that they wouldn't make a wrong decision about your financial statements. So people ask me, well, what does that mean? What are the dollar amounts that matter to you? Well, honestly, if money isn't coming in the door that should come in the door, or money is going out the door to somewhere it shouldn't, and it's fraud related, the number is like $1 to me. If there's money that we find during the course of our audit procedures that is related to misappropriation of assets, that is significant that I would let your board of directors know about. But there's other things that to us are less important. I would say your team does an excellent job of tracking the numbers coming in, the numbers going out, keeping course of your books and records. But if $1 is coded here or there into the wrong category, we talk to them about the implications of that. We didn't find anything like that this year. Everything during the audit came through just fine. But we also look at internal controls, which are the checks and balances in place to make sure that KANA operates with accurate information. So, for example, we're going to look to make sure timesheets are signed or approved by somebody who knows how someone is working. And we're going to look at bank reconciliations or who has access to release a check. And those are really important controls in place. And I do just want you to hear from a membership perspective that even with some turnover in your accounting team in 2022, those controls were maintained. Other individuals were able to step in and maintain those checks and balances throughout the year. So we didn't report any items on internal control. Other things we look at, we have to tell your board of directors if we found any disagreements or difficulties, if we had any reported significant deficiencies, any kind of significant unusual transactions. You had a few exciting things happen, which I'll touch really briefly on, but nothing significant in terms of issues or errors with the audit to report to you. We did issue an unmodified or a clean opinion on the financial statements. And that basically means that we believe that the financial statements are presented fairly in all material respects. And that's actually, several different statements, but your statement of net assets, your changes in net assets, and your cash flows. So that's as of September 30th, 2022. And we've already been talking to your teams about starting the 2023 audit because you're just past the next fiscal year. A few big things happened during the year. You had some significant continued grant activity related to COVID-19. Some of those grants were really new, and there were a lot of compliance requirements associated with them in order for you to accept them. But we didn't identify any issues there. You did issue the new bond for construction that was issued just after the end of 2022. And then there's some activity where KANA is assisting others holding funds primarily related to COVID-19 or BIA money. And that's being tracked. So we are kind of auditing that to make sure that's being tracked and categorized and held in secure accounts. I just discussed a little bit of staff turnover this year. So we looked pretty carefully at those controls to make sure that with the turnover, there was still adequate controls in place. There was a lot of capital activity, as you know, and then coming up in 2023, you have a new big accounting standard called 842 or leases. It's a pain in the neck. And so we did talk to the board briefly about making sure that KANA has enough adequate resources to implement that effectively next year. In terms of the single audit, on the state side, we audited your VPSO program. And on the federal side, we audited 3 different programs. The Coronavirus Relief Fund is actually the second year we've been looking at COVID-19 money. And then both your 477 cluster and the Indian Health Services Compact money were audited in 2022. 477 is made up of a lot of programs, including TANF and some child care grants and those kinds of things. So it's kind of a mix of a lot of programs. We didn't identify any compliance concerns or reportable conditions, no question costs, and we did issue an unmodified opinion on compliance this year. So I know that's auditor speak for this is a very boring audit report, but there were a lot of challenges. A lot of people had to step in to get through a significant amount of more work that goes along with COVID-19 funding and the grant requirements. So I just want to thank your team there for stepping in. I would say, the employees that do the day-to-day work are the reason that you came through this without findings, because it's the buildup of all the timesheets. It's the approval of every single invoice. And I'm sure that if you ask employees there, they find those things to be tedious, but they do all build up to an accurate financial statement at the end of the day and compliance with all your federal awards. That allows you to go after more federal awards and additional funding. Some financial highlights for you. Your statement of financial position shows you at any given point in time. So this is as of last September, what your assets were. Those are things that KANA owns. Liabilities are things that KANA owes to others. And what's left over is in that red box. That's net assets. That's the number then the orange box is net assets. That's the number I really watch. And I'm always monitoring my net assets of my clients to make sure that it seems sustainable with their increase in operations. And we've been looking at that with your board for several years, really looking at as you're growing as an organization, do you have enough working capital? Do you have enough resources to be able to do that effectively and sustainably? So you can see that orange box going up, your assets are increasing, but also your net assets is your equity, which is exactly the way that your board has been aiming for and what as kind of the financial side of things I like to see in your financial position. In terms of what your assets are, things that you own, the largest category there are cash and investments. You are required to keep a certain amount of cash and investments to cover grant advances. and also to, make working capital requirements to pay your bills, to weather the time between when you spend the money and when the granting agencies pay you back. And then you can see there's also property and equipment. So your building equipment, those kinds of things make up the second largest category of assets. Total revenue has increased steadily over the last, well, I have 6 years of data here. So you can see this year just about $52 million. It'd be interesting to see with 2023 how that changes. Keep in mind that this is total revenue. So your patient service revenue was a little bit different during COVID, but you had grant funding that overcame that. So now you're back to a little bit more of a normal risk mix, and you'll see that continuing to come back to normal in 2023 as the COVID-19 funding falls off and the patient service revenue recovers. And then in 2022, your revenue you can see is primarily made up of compacts and grants, but that big blue box, and then the big red box is patient service revenue. You have a few other things, including contract services, gaming income, investment income, those kinds of things as well. Total expenditures has also steadily increased. You can see that decrease there in 2020, but by far made that up in the last couple of years, for total expenditures of 41.6 million. And most of this is made up of health services. You do also have community services, a little bit of realty, general administration, and special projects. Generally speaking, I will say your general and administrative percentages are rather low for an entity your size. Your team does operate in a pretty streamlined manner. And I have been talking to the board a little bit about investments that you are planning to make or hoping to make as it relates to financial statement software, some investments in the health systems, that kind of thing that, I think will directly benefit KANA's beneficiaries as you move forward. With that, I just want to thank your team and all of you. Having a culture where you demand excellence certainly pays off when your board does an excellent job of asking for information and following up with questions. We had a great discussion in May, so I'm available for questions now if you have them. But I do work for the board of directors, but ultimately for all of you. So it's important to me that that if you do have concerns, please bring them to your board, and we're happy to look into them as we work through the audit. But I do just want to thank your team, especially your accounting team, who worked so hard to make sure that these financial statements are prepared timely and accurately for you as members. With that, Mike, I'll turn it back over to you and listen for questions. It may help if you repeat the question if they don't have a mic.
Thank you, Joy. Any questions? I see one question.
I'm not sure if is this on?
Yes.
If this is the right time, but Indian Health Services is supposed to help cover our medical, and I've been made aware there are people in our community that aren't getting health care because they don't have Medicaid, so they're healing and it's not being covered. What's up with that? We've got IHS, but we have to have Medicaid so you can charge the heck out of it. Not knowing it, you, ma'am, but it's a general question. Why aren't we being cared for under our Indian healthcare services if a person doesn't have Medicaid? In fact, Medicaid was applied for me without my knowledge years ago, and I can't get a question. So thank you for it. I appreciate it. That means I can go outside like Dr. Jones suggested the other day. But like I said, why aren't people getting treated if they don't have Medicaid? So I don't know if this is the right time with her, but it's a financial thing. And so I'm wondering if this is the right time. I'm Catherine, by the way.
Thank you, Catherine. Not sure if that's a question for you, Joy.
Well, probably one for you, Mike, but I will just say that the Indian Health Service Compact Agreement that was agreed to, a long time ago, does have requirements for KANA to be what's called the payer of last resort. So if someone is eligible for Medicare or Medicaid, KANA is actually required to build private insurance, Medicare, Medicaid, any insurance that that person has before it's applied against Indian Health Service funding. As in terms of whether somebody who doesn't have that can get care, that's really under the Indian Health Service program. There's requirements in order to do that, but KANA we do test eligibility for write-offs to Indian Health Service, and KANA does write off a significant amount of financial billings against the Indian Health Service Compact itself. So maybe Mike, you can hit her operationally how that works. But on the financial statements, there is recorded amounts of contractual write-offs to the Indian Health Service Compact.
Thank you, Joy. And thanks for joining us today. I understand you have a race to get to, so I hope you I hope your son does great.
Thank you. Well, I'm just hoping it finishes. So I'll hang around for a couple more minutes in case there's something else that comes up. But thank you everyone for allowing me to join via Zoom. Always a pleasure to be working with you and to see you all be so excited about your organization's future. Glad to see it.
Thanks, Joy. Well, thanks for your graciousness in allowing Joy to go on. She had something to get to, but we did have a motion and a call for the question and a request that it be a roll call vote. And we do have a list of folks who registered today. Is that correct? So we will run through that list. Are you gonna put the yes or no? That was, yes, yeah.
And please, just let me impassion you. If you don't understand one word of this document, please vote no.
Could you get on the microphone?
And vote to table it.
They can't hear over here.
Thank you. I'm asking that if there's anybody in this room who does not understand one word of this document that they presented to change the articles of incorporation, please vote to table it so that we can have an opportunity to go through it with KANA management and our board of directors in a work session. Thank you.
Doreen Anderson. Gerald Anderson. Melissa Burns. Jared Bazona. Sylvia Bravo. Carmen Ambrosia. Phyllis Amoto. Clifford Anderson. Mita Carlson. Debbie Carlson. Heather Carlson. Kyle Carlson. Hilda Charliega. Oh, Hilda Charliega. Hi. Yes or no on the vote to table the proposed changes to the articles? Oh, I'm sorry. Yes or no on the proposed amendment to table the articles? Yes. Nick Charliega. No. Celeste Chichinoff. Joan Chichinoff. Keith. Yes. Keith Chichinoff. No. Larry Chichinoff. Sabrina Christensen. Sarah Christensen. Andy Christofferson. No. Cheryl Christofferson. No. Olga Chaya. Angela Doherty. Marlene Dieter. Karen DeHart. Kelson DeHart. Joe Delgado. Sonia Delgado. Colin Denton. Dana Denton. Kathleen Druckery. Desiree Aluska. Kayla Aluska. Mary Fearn. Alicia Flores. Marvin Frost. Rosalind Green. Corey Grahn. Sean Hales. Pam Helms. Chrislyn Hohen. June Horn. Nick Inga. Marie Jamili. Julie Kaiser. Sandra Kotelnikoff-Lester. Amanda Kavanaugh. Patricia Kozak. Nina Crummery. Melissa Magnuson. Owen Magnuson. Denise Malutin. Helen Malutin. Janine Marsh. Wesley Martin. Clifford McCormick. Deborah McDermott. Marianne Miles. Beverly Moreno. Lars Naumoff. Where's Lars? Oh, decline. Is that a no? Oh, abstained from voting? Okay, thank you. Amanda Nelson. Axel Nelson. Loretta Nelson. Margie Nelson. Marilyn Nelson. Marilyn Nelson? Yes. Nancy Nelson. Abner Nelson III. Charisse Olson. Jolena Panamarioff. Lance Panamarioff. Natasha Panamarioff. Vicky Panamarioff. Alex Panamaroff. Heather Parker. Johnny Parker. Tatiana Parker. Serena Poulos. Jerry Poulos. Sean Price. Patricia Prince. Mavis Pruitt. Nicole Pruitt.
No.
Rebecca Pruitt. Darlene Rounseville. Teresa Schneider. Gloria Selby. Tikhon Semyonov. Eldon Skwortsoff. Lisa Truitt. Gertie Tveet. Carol Valley. Catherine Von Sheely. It's to table, to, correct,
Yes means to table.
for a work session or for. Gary Watson. Darlene Wearsome. Sharon Wolkoff. Sharon Wolkoff. Stacy Wolkoff. Terry Wolkoff. Bill Uvino. Willie Zeter. That's the list. Thank you, everybody. Thanks for your vote. Thanks for the process. Oh, okay. Carol Kotelnikoff. Is she on there? Okay. Okay. Yes. Okay. Thank you. Thanks, everybody. We'll add up the We'll add the totals. Carol? Yeah, yes. Okay. The motion fails. Thank you, everybody. The voting on this amendment went out by mail. It's been available this morning, and the polls will be closing in 15 minutes. I am going to jump back on the agenda to KANA staff recognitions. We always have the chance for you to meet KANA staff, the people who are working hard to support you, the people who worked hard to make today possible, and the folks that really make me proud because they work hard, they do a great job, and they care about what they do. We ask folks to file up past the podium one at a time to introduce themselves, their name, title, and years at KANA. It takes a few minutes, but I'd still like to do it. I think that it's important for you to see the people who are working for you. And I'll start with myself because I happen to have the microphone in my hand. I started working at KANA in 2006, October 10th. So if I make it through today and the weekends, that'll be 17 years. I don't want to count my chickens before the eggs hatch, but it's been a long time of service to KANA, and I've been at KANA, stayed here because of the people that I work with, the people that I support, the board of directors, the beneficiaries, and the community. This has turned into my home. I really like KANA. It's been a great place, and I hope it is for everybody here. I know that there are times when KANA doesn't meet the expectations that you have, but as an organization, I believe we try to stand up when that doesn't happen, and we try to make Kodiak and KANA better tomorrow than it is today. So if I could, I'd like to ask folks to come on up here and introduce themselves. And this will take a few minutes, but again, I think it's important.
Hi, everyone. My name is Nicole Pruitt. I serve as the Vice President of Public Affairs, and I've been with KANA for 13 years.
Hello, my name is Jen Caskey. I'm Chief of Staff, and I've been with KANA for 6 years.
Hi, I'm Casey Peavy. I'm the new Peer Support Supervisor. It's a new program at KANA, and I've been here several months now.
Shemai, my name's Heidi Christensen. I'm from Old Harbor, and I've been with KANA, the Behavioral Health Department, for 6 months.
Hello, my name is Tatiana. I work at the front desk, and I've been here for a little over a year now.
Hi, my name is Sam Booch. I'm from here in Kodiak. I work with the administrative department, and I've been with KANA almost 6 years in November. Thank you.
Hi, my name's Chloe Jeffco. I'm with Employment and Training, and I've been here 2 months.
Hi, my name is Brittany Feltoff. I'm the Workforce Development Specialist. I've been with KANA for 4 months.
Hi, Rosa Skonberg, Workforce Development Manager, and I've been with KANA for 8 years.
Hi, my name is Ivan. I'm a business technician, and I've been with KANA for 3 years.
Hi, my name is Carrie Halter. This is the second time I've worked for KANA. The first time was 2 years from 2012 to 14, and I've been back now just a little over a year. Oh, and I am the Social Media and Design Coordinator in the Communications Department.
Hi, everyone. I'm Lisa Truitt. I've filtered through a couple departments within KANA, so I've been with KANA almost 5 years in January. I am now in Prevention Specialist.
Hi, my name is Colby Perez. I've been at KANA for almost 2 years, and I'm a behavioral health clinician.
Hi, my name is Angela Alejandro. I'm one of the support services case managers with the Workforce Development, and I've been with KANA for 2 years.
Hi, I'm Jasmine Leva. I'm the Support Services Coordinator, and I've been with KANA for a little over 2 years.
Shemai, I'm Lori Walker. I'm a tribal vocational rehabilitation counselor. I've been with KANA for 5 months.
Hello, I'm Wesley Martin. I'm the facilities foreman, and I've been with KANA for 7 years.
Hello, I'm Julie Kaiser. I work as the Indian Child Welfare Coordinator, and I've worked for KANA for 15 years now.
Hi, I'm Arwen Boats, and I am the Vice President of Community Services, and I have now been with KANA for a little more than 10 years.
Hi, everyone. My name is Kylie Yavorsky. I am Tlingit of the Raven Moiety, and I belong to the Kiksadi clan. I am KANA's Communications Manager, and I've been with KANA for 5 years. Thank you.
Heather Burke, Infant Learning Coordinator. I've been with KANA for 2 years.
Hello, I'm Claudia Otis. I work with Chamaya Home Visiting.
Hi, I'm Roger Mendoza. I'm a career specialist, and I've been in KANA in 4 years.
Hi, I'm Madeline Egdorf. I'm a human resources generalist, and I've been at KANA for almost 3 years.
Hi, I'm Dawn Osterman. I'm a staff accountant in the finance department, and I've been with KANA almost a year.
Good day, I'm Bernadette Villaroya. I'm in Kodiak for 20 years. My first year, I was working with a Fognak Native Corporation. I work with school district, city of Kodiak, and now I gladly joined KANA since last year. Thank you.
Hi, my name is Danielle Butts. I'm the Family Services Coordinator. I operate our tribal victim services and family violence prevention programs, and I've been here for a year.
Hello, everybody. My name is Andy Wall. I'm the Environmental Coordinator at KANA, and I work on solid hazardous waste management and water quality monitoring. I'm creeping up on 5 years.
Hi, everyone. My name is Tina Enninga. I'm the HR Director, and I've been with KANA. It'll be 6 years in January.
Hi, everyone. I'm Cassie Kettblinger, Elder Services Director, and I've been at KANA for a combined total of about 11 years.
Good afternoon, everyone. My name is Carissa Stoker, and I'm the VP of Health Services, and I've been at KANA for 7 years this month.
Hi, my name is Melinda Cortez. I'm the credentialing specialist in the Human Resources Department, and this time around, I've been with KANA for 2 years.
Chimay, I'm BC Valenzuela, and I am the Administrative Manager and I have been with KANA for 3 years.
Hello, my name is Kelly Slavin. I am the Patient Experience Director for KANA, and I've been here for 2.5 years.
Hello, my name is Catherine Gran. I am a registered dental hygienist, and I've been with KANA for 13 years.
Hi, I'm Patricia Hines. I am in payroll and benefits, and I've been with KANA for 6.5 years.
Hi, I'm Sarah Arneson. I'm the Clinic Operations Director, and I've been with KANA for 4 years.
My name is Penny Boucher, and I'm the Elder Services Coordinator, and I've been with KANA for a total of 9 years.
Hello, my name is Zoe Vitkus. I'm the Community Care Coordinator, and I've been here since the end of August.
Hello, I'm Wesley Olson. I'm one of the other PC technicians, and I've just been here a year.
Hello, I'm Alicia Ita Flores, and I'm a cultural peer support specialist. I've been with KANA for 8 weeks.
Hello, my name is Anna Castro, accounting technician, and I've been with KANA a year and 4 months.
Hello, my name is Dave Castro, and
I work for facilities. I have almost 3 months with KANA.
Hi, my name is Paige Thies. I've been with KANA for almost 3 years and I work in HR.
Hello, my name is Stacy Wolkoff. I'm the Purchase and Referred Care Director. This is my second time working for KANA, about 9 years this time around.
Hello, my name is Connie Masterson. I've been with KANA for 1 year and I'm a care team navigator.
Hi, my name is Rosalind Green. I am the Patient Benefits Coordinator and I'll be 3 years next month with KANA. Thank you.
Hi, my name is Marilos Fangunilo, Patient Benefits Coordinator, and I've been with KANA for 6 months.
Hi, my name is Rachel German. I'm a physical therapist and the Director of Rehab Services. I've been with KANA for 2.5 years.
Hello everyone, my name is Ladsel Vista and I'm working as postal clerk and I'm happy and privileged working with KANA for 9 years.
Hi, I'm Dr. Stephen Tullis. It's my pleasure to be your staff dentist for almost 7 years.
Hello, my name is Pablo Gonzalez and I'm the dental director. I've been with KANA for 3 years now. Thank you.
Hey everyone, I'm Brent Gard. I'm a behavioral health aide from Larson Bay and soon to be a patient advocate up in Anchorage. Been with KANA for 6 years.
Hello, my name is Ali Snyder and I am the Rehabilitation Services Office Manager. So, thank you.
Hi, I'm Hannah Reyes. I'm the exercise specialist. Been here for 1.5 years.
Hi, I'm Damiana Odi Hakmet. I am the Chief Dental Assistant and I've been with KANA for 10 years.
Shema, I'm Heather Parker, member of the Shunak Tribe of Kodiak. I'm a registered dental hygienist and case manager, and I've had the honor of working with everyone for 28 years now.
Shemai, my name is Esther Anderson. I am one of the phlebotomists here at KANA, and I've had the pleasure of serving KANA for 10 months.
Good afternoon, everyone. My name is Jim McClellan, and I am the Facilities Director for KANA, and I'm getting ready to kick off week number 6.
Afternoon, everyone. Ali Vayani, serving for 3 months as the comptroller here.
Hi, I'm Trinity Jeffcoat. I am the communication specialist and photographer, and I've been here for about 3 months now.
Thank you. Thank you to all the staff who introduced themselves. Thank you to all of you for being so warm and gracious. And again, I think it's really important for you to see the people that are working for you, the number of people that you have out there offering support, and that they get to see who they're serving. So thank you. I know we went through and folks told you how long they've worked at KANA, but there are a few people who have hit certain milestones that I'd like to recognize. We have several people who have reached 5 years with KANA. I'd like to go through that list alphabetically. Many of them are here and you've already heard from them, but I'm going to go through that list. Sam Booch, Stephanie Brentison, Jennifer Caskey, Melissa Cook, Ralph Dahlstrom, Tina Eninga, Rochelle Ferris, Ashley Frost, Hannah Gordon, Hope Livingston, Chris Luckenbach, Samantha Marlar Enbaum, April Madrid, Michelle McClure, Carissa McElwain, Trevor Phillips, Shanna Rockenbach, Adriana Sala, Juvie Small, Allison Starr, and Kylie Yavorsky. That's 21 folks who've hit 5 years for you. Thank you. 10 years. Arwen Boats, Marnie Kilborn. Yeah, there's not so many. You can clap after each one. Arwen Boats. Marnie Kilborn. Jason Caney. Damiana Ode. Dr. Elise Pletnikoff. Now we're at 15. We have Hope Howell and Julie Kaiser. I see I'm being prompted from the back of the room. Oh, Julie, come on up. While Julie's making her way up front, I'd like to mention our 20-year milestone, Ms. Martha Keegan, who is a certified dental assistant. Martha began her career at KANA in 1979 as a nationally certified dental assistant and assisted Dr. Bill Murdoch with setting up the original dental clinic from scratch at the old downtown location. Martha has served as an integral part of KANA's dental team and remains committed in providing compassionate care and positive patient outcomes. Thank you, Martha, for 20 wonderful years of service to KANA and our beneficiaries. We do have one last person I'd like to recognize, but first, this is for Miss Julie Kaiser. In appreciation for your 15 years of service. Thank you. And we also have plaques recognizing other folks who've hit milestones. Oh, before you run off, Julie, there's more. Thank you. Well, I'm glad you came. Thank you. These flowers might be for me. There's one employee, one person who served at KANA for quite some time in a number of roles, always, to me, exemplified what we wanted KANA to be, which is an agency that serves our beneficiaries and tries to do better tomorrow than we do today. And she's not going to like this, but I saw her here. Miss Pam Helms. Pam just reminded me that she doesn't work at KANA anymore. But she did for 36 years. So you're still part of KANA, Pam. You just don't get a paycheck. Pam served our community and organization for nearly 36 years. We're going to say 36 years. Pam has truly embodied our mission of elevating the quality of life of the people we serve, most recently as our patient advocate. Her dedication, compassion, and hard work have made a lasting impact on our community, and we are immensely grateful for all she has done. Pam, you are deeply missed at KANA. I'm going to look to staff to see if I've skipped over anything on the agenda or missed anything important or not important, just anything. No? Well, if there's nothing else regarding staff, I do want to mention Ms. Desiree Luska, and Desiree's here. There's Desiree. Desiree served on the KANA board for the last 3 years, representing the native village of Akiak. Desiree is a young leader. She is intelligent, compassionate, and caring. She did a fantastic job on the KANA board. She represents Kodiak and her people, and she will be missed on the board, but I'm sure that we'll see her again. And thank you, Desiree, very much for your service. Thanks, Desiree. Yeah, sure.
I'd like to thank everyone, especially the board members and Mike, for all their support for over my 3 years. It was a wonderful experience. My grandpa, David Iluska Sr., he served on the board for many years, and he always encouraged us grandkids to take after him and step out of our comfort zone. And so when I got asked to run for Kodiak, I immediately thought of him and thought I would do it for him. And I knew that he would be so proud of me. And yeah, I enjoyed it. And if I could, I would run again, but it's beneficial for our members more if they're living in the village. And thank you, Mike.
Thank you again, Desiree. The election results are being tabulated. We do have some prize drawings, and then an adjournment and lunch. So what I may do is, first though, are there any comments from folks in the crowd?
Thank you, Mike, and thank you to all the staff. That was a wonderful presence. Ironically, I'm born and raised here, Corey Grawn, in this community. The last time KANA had a presence downtown was in the old building for medical and dental there. And so being able to be here at my first annual meeting, it's wonderful in this new facility that I'm proud of. You guys have done a wonderful job. It's clear you guys are a employer of choice by 36 years and 20 years. So keep doing what you guys are doing. I look forward to what you guys will do for us ahead. I would say a little criticism as a joke. I'd be concerned about the overtime today, but based off your balance sheet and last year's $9.5 million, I think we can afford it. So great job, everybody. Also, I think we'll get a good break on the rental space today, right? So anyway, thank you guys for what you do. I really appreciate everything and today.
Thank you, Corey. Any other closing comments from folks? Well, just checking. I was hoping that wasn't going to come up. No, I'm just kidding. Everybody who's working today will be duly compensated for their time, and we appreciate the time that they've taken. The time off and the compensation that comes with the days worked or the time worked today. But thanks for the reminder on that, Corey. I didn't want to let anything slip by. Okay. Well then, since we do have our election results being tabulated now, I would go ahead and, if we want to do the drawings now, the raffle, let's do that.
Okay, so the first thing we're going to be announcing is the Native Village of Kodiak and the Native Village of Afognak were voting for their members on the board. So out of those returned ballots, the Native Village of Kodiak, there's a $100 gift card for Melanie Rostopsov. Is she here today? Okay, and then for the Native Village of Afognak, the winner is Otto Molly Jr. And then all of the ballots that were returned where you voted for the articles, the winner for that is Lori Palmeyer. Okay, so we're going to be drawing tickets for these raffle prizes. The first one we're doing is a winter beanie with the KANA logo on it. Lucas, could you go ahead and pull one out? Terry Wolkoff. And then another winter beanie, and that winner is Kelson DeHart. A third winter beanie, Sylvia Bravo. And the last winter beanie goes to Tatiana Parker. They're saying she's over there. This one now, the beaded hairpin. Okay. Next is a beaded hairpin. Carol Valley. We've got a couple of KANA hats. Corey Grawn. Another KANA hat. Lars Naumoff. Another KANA hat. Owen Magnuson. More hats. Carol Kotelnikoff. Not sure where she went. And another hat. Gloria Selby. This is the last KANA hat. Stacy Wolkoff. The next item is an ivory mask. Sandra Kotelnikoff. Do we know who carved it?
I am not sure at this moment, but I can find out.
The next item is a pair of fur mittens by Susie Malutin. Natasha Panamarioff. We have a pair of kids' slippers by Susie Malutin. Clifford McCormick. Let's move this way a little bit. A $100 fuel gas card. Helen Malutin. Another $100 fuel gas card. Abner Nelson III. No, I'm sorry, Jr. Abner Nelson Jr. Another fuel card, $100. Melissa Magnuson. $100 fuel card to Kathleen Druckery. And the last $100 fuel card is Marianne Miles. Next is a piece of framed art by Hannah Scholl. Wesley Martin. Next is an ivory grizzly bear. Cliff Anderson. $100 Visa gift card. Serena Poulos. Another $100 Visa gift card. Nina Crumry. $100 Visa gift card. Is that Kyler? Kyler Pengal. One more $100 gift card. Olga Shaya. Next is a salmon skin wallet. Patricia Prince. No, the earrings. We have a pair of earrings from the Lutic Museum. Carmen Ambrosia. Now we have this Kuspuk. Tikhon Semyonov. We have a $200 gift card from KEA. Nick Charliega. Another $200 gift card from KEA. Marie Jamili. Another ivory grizzly bear, Denise Malutin. Next is this bison basket. Gertie Twait. Then we have this framed art by Alvin Amison. Amanda Kavanaugh. Do you want to get it now or pick it up later? Okay. Yeah, she'll pick it up now. Frame. Next is this framed chart of Kodiak Island. Joan Chichinoff. Do you want us to hold on to it and you'll pick it up later? Okay. Next is this MacBook Pro. Eldon Squartzoff. And the grand prize, 30,000 Alaska Airlines miles. Sonia Delgado.
I never win anything. We have lunch. The election committee is counting the ballots as we speak, so I propose we grab lunch. But first, I understand Miss Denise May had asked if she could say something, so we'll hand the microphone to Denise and then take lunch.
Thank you, Mike. First, before I say what I wanted to say, I want to thank KANA for all the service they provide to Kodiak and to the villages. I am very thankful we have that service. COVID really showed us what an organization like yours could do, especially for the villages to keep us safe during that time. Right now, and I'd also like to thank KANA for the support you gave us in writing the grant for the $30 million we received for that internet project going into Uzinki, Port Lions, and 4 villages on the chain. I am so thankful for you, Mike, specifically for all the work that KANA did, and then when we asked for a back off, how you backed off, and we've taken it and run with it on our own, and you've been very supportive. KANA's been very supportive of us as we've moved forward with that. But now what I really want to talk about is on the 27th and 28th of this month, we don't have the agenda set yet. We'll be having an island-wide broadband summit for the tribal councils and the administrators on the island. And I'm really encouraging you, every one of you, to come. We have some innovative stuff going on in technology that's going to help both our cell and internet services in the villages beyond what we're doing in this grant. And we have some people coming that can explain all that to you. And I wish I could explain some of it to you now, but I don't know how I got in this broadband space because I'm not very tech savvy, but I've got the people there that are. So I'd encourage you, you'll be receiving an invitation. Every tribe on the island will be receiving an invitation with an agenda. And our request is, and it's going to be hosted by the Native Village of Port Lions right here in this building. And so our request is that you take it serious and bring as many of your council members as you can. And so that's what I wanted to say. I wanted to make everybody aware of it because time is short. We've been pulling this together rather quickly. It's something we feel like we have to move on rather quickly on. So that's why there's such short notice. We just started working on this 2 weeks ago. So please look out for that invitation and make sure that you consider participating, and not just each administrator, not just one council member. It would be really good to bring as many as you can. So thank you.
Thanks, Denise, and I understand there's one last comment before we go to lunch.
Hello, Darlene Roundsville. I'd just like to put a couple of shout outs. If you have not taken advantage of the KANA Wellness Center, I'd strongly encourage you to. They have wonderful classes and all kinds of equipment and all that you can partake of. The other is, I didn't realize this, I've reached the status of Kodiak Elder, and I appreciate the gifts that we've received the last few years and the services that you guys provide for us. Thank you now.
Thank you, Darlene. Lunch is outside, so if we could allow elders to go through first, that'd be appreciated, and let's grab a quick bite. Thank you. Just received the results of the 3 elections, so I was going to go ahead and announce those for you. For the Native Village of Afognak, Loretta Nelson with 24 votes won. Also receiving votes, Yvonne Mullen 4, Natasha Hayden 1, Rodney Kanigan 3, and Sabrina Sutton 1. For the Native Village of Akiak, Tikan Simyanov won with 7 votes. The proposed changes to the articles passed, 254 yes, 19 no. We've concluded all of the items on the agenda. Do I hear a motion to adjourn? Moved? The motion has been made and seconded. We're adjourned. Thank you, everybody. Thanks again. I really appreciate it. At 1:13. But thanks again for coming out, sharing your comments, sharing your time with us today, spending time in the building with us. And again, we hope you enjoyed yourself, and we look forward to seeing you again. Thank you.